Hi, this is your Houston chiropractor, Dr. Gregory Johnson. We've got Bobby back in here with us this morning, and I wasn't really satisfied with some of the diagnostic test results that he had brought down here with him from Chicago. So I ordered some new diagnostic studies on him yesterday, which he had done yesterday afternoon, evening here in Houston, and I've already got the reports back. I thought he had a kidney stone that was causing viscerosomatic reflex pain into his lower thoracic paraspinal musculature, and sure enough it shows that he has a 6 by 4 millimeter oval shaped kidney stone on the left kidney. Now also down there with the CT scan, we've got significant thoracolumbar, which means T12L1, spondylosis, that's degenerative joint disease, and osteophytes, that's spurs, with facet arthropathies, that's degenerative joint disease, wear and tear, osteoarthritis, those are all synonymous terms. Right down there at that T11, T12, L1 area. And he does also have a disc protrusion at L1 and L2 with a 3 millimeter right paracentral disc calcified disc bulge. Now that means that's been there for a long time, and it's actually got calcium developing in the disc bulge itself, which can impinge on those nerves coming out of there. So he truly does have a neuromusculoskeletal issue. The skeleton is degenerating the spine, that's the skeleton, the bone part, and then that's pinching on the nerves, that's the neuro part, and that's causing the muscles to go into spasm and giving him that sharp stabbing pain that he's been dealing with for how many years now?
3.
3 years now. And he's been told by a spine surgeon, correct, that you need to have a spine fusion.
Correct.
Down there at that level, because he saw some slippage when you went flexion and extension.
Correct.
Yeah. That's a decision that he'll need to make with his family and himself and the doctor that he's going to see. I would recommend continuing to get adjusted, but also consider some facet injections into the T11, T12, L1 facets themselves to get some localized anesthesia in that area, and that may help. That's also a medical decision. We don't do facet injections or prescribe medications, but in dealing with these types of spine problems for quite some time, you've already had epidural steroid injections, and that didn't do a thing for you.
Nothing.
And he's been told by one nephrologist that he didn't have any kidney stones that were significant enough to remove, or he couldn't remove them.
He couldn't remove, and he says that there was no way that...
He said there's no way that could be causing the pain, but I beg to differ with that. I think that also could be a component of your pain, which is why we sent him out for these tests. And he also has bilateral inguinal hernias, which we discovered, and you didn't know that, did you?
No.
So I'm recommending and referring him to a general practitioner who specializes in internal medicine, and also a general surgeon, and a spine radiologist or orthopedic or neuro that can do the facet injections down there, if that's what they agree to do down there for him when he gets back to Chicago. But Bobby, would you tell him how you feel overall since you've been here, and if this has been worth the trip for you to come down here to Houston from Chicago?
It's absolutely worth the trip. Besides that back pain itself in that one general area, I still feel from day one taller, lighter on the feet, and I haven't had that for years. I felt like I was just compact, compressed, and always in pain.
Yeah, we got some additional diagnostics done on you too that gives you some new directions to go.
Right, and been dealing with this for 3 years and didn't get all this, and I'm here for a few days and I get all this, so it means something to me.
Great. Well, we're gonna show them your last treatment today, and then you're
Alright.
off to Chicago, huh?
Off.
Hey, how about those Astros?
There you
We
go.
won last night out in LA. We're coming back to Houston on Friday, Saturday, and Sunday, guys. Okay, let's have you flex your head forward and backwards for me, please, Bobby. Yeah, it was a late night for a lot of Houstonians, so everybody's tired today. Okay, see your head's still a little forward and over to the left of center. Your pelvis is more centered up today though than it has been. So I'm not going to do the knee chest table on you today just because I don't want to inflame that area anymore. But we are going to decompress you. There we go. His back's a little more sore down in that T11, T12, L1 area on the left from laying down on those hard CT scanner beds. Tables, I should say. Suck it up. There you go. Okay. That's what Renee always tells me. Give me a little break. She just suck it up, you busy. We had more huge questions come in yesterday in one day. I thought she was trying to tell me something. There. I had a huge workout yesterday. That's why we didn't get any videos done yesterday. Whew. There we go. Should have felt that all the way down, did you?
I did.
Okay, good. There we go. Okay, I got you. There we go. Good job. That's like an Altuve homer right there. That's a good spinal Palmer diversified rotary grab. Okay, so we're kind of get up sideways. Well, you're definitely moving better than you were the first day I saw you. You're not as stiff as you were. You feel like you're moving around a little easier than you were?
Yeah, in the upright position, absolutely.
Okay, good. Left leg's coming up short by 1/2 inch. There's nothing chiropractic can do to help inguinal hernias, so he's gonna have to see a general surgeon about that. There we go. So diagnostic testing is very important to come to a differential diagnosis of what the actual underlying cause of the problem is. There we go. Yeah, keep breathing. There we go. Almost there. Okay. See, he's got a lot of splinting muscle spasm in there still as a result of those facet arthropathy and he's splinting muscle spasm down in the T11, T12, L1 area on that left side. But that actually causes tightness in all the paraspinal muscles. Let's check his leg length here again. Legs are even now, and they stay even. Does that tighten up as much as the first one? Good. Okay, you're gonna feel your head popping up a little bit. There we go. Okay, now let's turn you on your back. You'll see it's hard for him to lay on his back because when he lays on his back, he puts pressure down on those facets down at T11, 12, L1. Well, that's the best I've seen you lay down in a few days. There. Good. Okay, let's put your arms out to the sides. Slide down just a little bit for me, Bobby, on this. Painful. There we go. Okay. Let's relax your hands on your tummy. There we go. There we go. You know, as I was talking in Bobby's last video, we don't guarantee results for anybody because sometimes pain can be coming from other sources that chiropractors don't deal with. And we try to eliminate the sit up face this way now. There you go. That's why it's important for your chiropractor to refer out to the appropriate medical specialists when necessary and do the appropriate diagnostic tests when necessary so that you can make a clinical decision about what's in the patient's best interest. There we go. Because I told Bobby the first day he was here and even before he got here that we see the kind of problems he has every day, but there's no guarantees for anybody. There we go. But what's most important to me is if the patients are happy with the services that we provided to them and feel that they've received some benefit. Okay. All right, let's have another look at that. Much smoother on that. You're not in as much distress as you were that first day. Do you feel that?
Yeah, feels good.
I mean, you're not in as much mental and emotional distress as you were that first day either. Okay, yeah. Try that same thing again. Yes, sir. Right down the middle. Very good. Is there any more thoughts you'd like to share with people from the weeks?
If anybody is thinking about surgery or anything, get in here. That's all I can say. It's worth it.
Well, thank you for sharing your story with everyone
Thank
this
you.
week, and we wish you the best. And you know, Renee and I'll be praying for your healing every day.
Appreciate it, and I will
So-
see you soon again.
Okay, this is your Houston chiropractor, Dr. Gregory Johnson, coming to you from Advanced Chiropractic Relief in Houston, Texas. We'll see y'all soon.